Hello, everybody. Thank you for joining us here today. My name is Fabiana Bacchini. I'm the Executive Director of the Canadian Premature Babies Foundation and also a preemie mom of a boy who is now 8 years old. And every Friday, 1 p.m. Eastern Time, I've been hosting Facebook Live, bringing experts, researchers, parents to share with us their experiences, their knowledge and expertise in different areas of our lives and what is happening in the world right now in terms of the COVID-19. And today we are going to talk about going back to school or starting school in the middle of this pandemic. And I have here with me today, Shanon. Okay, Shanon, I lost your bio. So Shanon Nancekivell, who is a special educator teacher and a parent of a 25-week born at 600 grams, who is now 10 years old, and her full-term little sister. Before becoming a teacher, Shanon completed a Master of Science degree in Occupational Therapy and uses this experience and knowledge each day while working in her classroom. As both an educator and a preemie parent, she's looking forward to sharing her experience navigating the educational system in this dual role. Shanon, thank you so much for joining us here today. And thank you so much for taking the time away from your family to share your knowledge and your experience with us.
Okay. Thank you so much, Fabiana.
So Shanon, tell us a little bit how you became a preemie mom and what was your experience as in the NICU with your daughter and going home?
Yeah, so I became pregnant a little over 10 years ago, and things seemed to be going just fine, and I started to just feel unwell at around 24 weeks. Headed into my midwife, eventually actually ended up at my family doctor, and I had really high blood pressure, experienced preeclampsia. I was transferred into the care of an OB at that time, and then developed HELLP syndrome. Which put my life at risk. When my daughter was born, they said I had about 12 hours probably before I would have suffered multi-organ failure. So there was no option but for her to be born early. And that happened, as you said, at a little over 25 weeks. And she was born at a pretty small 1 pound, 5 ounces or 600 grams. And she embarked on a 101-day NICU journey. And interestingly, at the time she was there, McMaster had a lockdown on their NICU and there were not visitors allowed. I spent most of my days by myself, so I do empathize greatly. Shortly after my stay there, they reneged that. They were doing it for infection control purposes. Infections did not decrease with the limited visitation, and they opened up visitation more again. So I empathize with the COVID situation in the NICU because they very severely limited visitors at the time I was in the NICU. So I understand a little bit of that sort of experience that's going on right now. In the NICU, my daughter had a pretty typical, if there is a typical NICU stay, she was, for micropreemie, she was intubated, extubated, intubated again, you know, retinopathy or prematurity, failure to thrive, infection, brain bleed. So kind of that full gamut. She eventually came home almost right around her due date. And yeah, then we embarked on navigating the medical system from home. I believe the first week she was home, she had 4 different medical appointments the very first week. So you kind of are happy to be home, but I must have been back to McMaster University in Hamilton 3 times the very first week she was home. And then in Ontario, we're lucky, we have a generous mat leave policy. So I was able to stay home a year with her, and actually over a year. And when I went back to school, back to work as a teacher, at school, my daughter entered the daycare system. So where she went as a, to like a center versus a home daycare, which I know many of people.
So how was that transition? Because I think that is the point where many parents are right now. You know, for us, I think preemie parents is always a difficult transition, leaving home where, you know, you protect your child, you know who is coming or leaving the house. And then you go to this daycare where they're exposed to big germs and viruses and flu and a lot of different people. So how was that transition for you at that time?
Well, my daughter started in cold and flu season. She started in September, the start of cold and flu season. When I went back to work to teach, as we know, school starts in September. So we had a lot of decisions to make. I know people struggle with, you hear on online forums, should I go to a a home daycare, maybe there's only 5 or 6 kids versus a bigger center. So we were very anxious what to do. At the time, my daughter only weighed about 10 pounds. When she was over a year, she hit a year, she weighed 11.5 pounds at a year. She's very, very tiny. She had severe reflux, like out her nose across the room, reflux. And so we ended up going with a center simply because of the amount of additional care she needed in terms of every time she fed, sometimes you had to feed her twice. I couldn't imagine her refluxing on someone's carpet in their home and them having to clean it up, that sort of thing. And actually, and we'll talk about it later, is just about the advocacy piece and being really straightforward with the daycare center. We told them everything that was going on with her, and we said, how will you meet her needs? And they were actually able to access extra funding for her and to get extra staffing to assist her because of her size, because of her reflux, to be fed. They put a plan in place for her. So even at the daycare age, we were able to have a plan for her to transition, which was very lucky. And they actually able to get extra staffing through some funding in the province. I'm in Ontario, sorry for everyone out there, that the province of Ontario offered at the time. So it's just really important if you're transitioning anything sort of that's governmental based to be asking about additional services or what can be available and giving them a full view of your child, right? And then if you're going to a home daycare, a similar thing, give them the full view of what your child is. But it was very difficult. I know at the time, 10 years ago, there wasn't a lot of online support. So I missed the part that you should be maybe isolating your child. That kind of was a big thing that like I found from the American side. Now as an older preemie parent on the online forums, they're big into isolation, even pre-COVID down there. You have a preemie, don't take them anywhere. I didn't have that experience. I wasn't kind of in the online world. So we'd kind of been out and about in the world a little bit, within reason, lots of hand washing, kind of like during COVID. But it was very stressful. Would she get sick? What would happen? We talked to our medical people. Did they think she was a good candidate to go back? Should I extend my maternity leave? So it really is a personal decision. But when you decide to send your kid out there, it'll happen one day for most people. We just gave them all the information we had.
That is so very important. And sometimes you say all the hand washing, the isolation, I feel like the NICU kind of prepared us a little bit to what we're living right now with, being home, being isolated, hand washing again, and, limited the number of visitors. So I think the NICU really, I kind of put that in our brains and prepared us for this.
I can remember with my daughter, people came in the house. We had a powder room on the main floor. They went to the powder room. They had to wash their hands. We were really big, like, please have your whooping cough vaccine. Or do you have, like, for family members who are going to be holding her, washing their hands before the game. If you had a sniffle, you were not welcome. Which back then I think was more like, oh, well, I just have a sniffle. No, sorry. We have compromised lungs here. We're not going to invite people into our home who have a sniffle, which kind of is the advice today, right? You're symptomatic, stay away. So yeah, it really did prepare you. A lot of the same things were in place, the washing of the hands and the distancing, right? You didn't let every person touch your baby. You're right. We really were kind of trained in that.
Absolutely.
That way. And so then you take care with 25 other people, right?
Yeah, so let's talk a little bit about starting JK, because that is the next big transition, because some parents decide to stay home until the kids go to JK, others have this transition from daycare to JK. But regardless, going to JK usually is a much bigger setting, many more children, many more people around, and so many different settings around as well. So how was that transition for you? What were the main concerns that you had, and how did you address them with the school system?
Yeah, I think what is most important or one of the things to remember is that preparation for school really starts when you're kind of bringing your child home from the hospital a little bit in terms of early intervention, right? That even before school is on your mind, the idea that your child and your child should be accessing the services that are available to maximize their potential and what they're able to do and access those services. So in Ontario at the time, there were follow-up appointments at the NICU my local children's treatment center. My daughter went for all her follow-up appointments. So it's extremely tiring. It wears you out. I don't know if you, Fabiana, feel the same way. It's like one appointment after another. But the great part is if you take advantage of all of those, you'll be able to come to school with a lot of information already about your child that you can then share with the staff at the school, right? You'll have information and be able to tell them maybe what their diagnoses are. So my daughter had speech language issues. She had hearing issues. She also was eventually diagnosed with a growth disorder, but weighed only 18 pounds, right? So it was important for me to have a discussion with the school, like, will she be able to reach the table to eat? What sort of stools do you have in the washroom, right? She was the size of a 12 to 18 month old, but going to school. So really having those open conversations and providing the school with what I knew about my child so they could best meet her needs. So we started that conversation before she ever entered the doors of the school, right? We enrolled her and we contacted the school and we said, hello, she's coming this next year. She was a preemie and she has diagnoses and some needs that'll need to be met. So can we get together and meet? In the age of COVID, that's a lot more difficult. It would be over Zoom or something of the like instead of in person, but we were able to get together and talk about those things and find out how the school, much like the conversation with the preschool. So now how are you going to meet these needs in the school setting, right? And I was armed with a lot of information because I'd, along the years, accessed a lot of those early intervention services. So I knew a lot about my child in terms of that therapy piece that I could transfer on to the school.
Shanon, but as a teacher, even if there is no diagnosis or no apparent concern entering JK, do you think it's still important for families to share with the school that the child was born prematurely? Because now you know through research that any baby born preterm can have some challenges, and sometimes the challenges don't show up until later on in life. So what is your take on that?
My take on that is to put it how you put it, right? If you only say, I had a premature baby, and you kind of leave it at that, they might get a glassy-eyed stare. I was saying earlier when we spoke, there's no like checkbox for prematurity. There's no like flow chart. Oh, premature baby. Oh, this is what I should look for as an educator, right? We're very driven in the educational system, much like the healthcare system, by diagnoses and by those things. So it's important to phrase it like you did, that there's research out there and information that preemies as they move along in school can struggle. So if you see any warning signs in their language development, in social development, in physical, anything you see, to like really come right away and not maybe often kind of in kindergarten, they're like, well, it's developmental and we'll kind of like wait and see, right? But if you kind of have your child identified as a child, well, maybe the best thing isn't maybe to wait and see with this child because they were born premature and we know that potentially they will struggle. And so maybe these are more warning signs and they'll hopefully keep a little bit of a closer eye on your child, right? Because you have to remember, these classrooms are large, up to 30 kids in Ontario, back to the Ontario story, but you have up to 30 3 to 6-year-olds in a classroom. So for them to just be aware that there are concerns, they might it lets them center their focus a little bit for that teacher on your child. Versus like they might see something and think, oh, that'll maybe resolve itself and I shouldn't, but you know, if they have in their mind, oh, this is a premature baby, maybe they've had some physiotherapy, maybe they don't have a diagnosis, but they have had physio assessments or OT assessments, or maybe they saw a speech therapist or, you know, whatever it is. If they have that in the back of their mind, then, and you keep that open communication, then hopefully they'll bring those to you, those concerns sooner rather than later, right? So you don't end up in a situation where your kid's now in grade 3, you've never said anything, they've fallen behind, and suddenly you're like, well, they were premature, and right? You don't want to be having those discussions when they're in grade 3, you want to be having those discussions when they're in JK and when they're in SK. Because early intervention is so key, and there's lots of research about that now too, about how important the early years are to development, and that you're getting those interventions at the appropriate time and at the soonest time that they're helpful. I'd be honest with the school. That's
absolutely.
and talk to them, make sure they know who you are, and everything, and like what you want for your child.
Absolutely. I think this is so very important because my son, he has a lot of the diagnosis, he has cerebral palsy, and he did go to specialized schools for JK, SK, and we're very fortunate to have a speech pathologist following her who actually detected that he had a processing issue. So he could hear, he could read, but he was not processing the information. So he could actually understand what he was reading. So it's been a lot of years for working on that piece. He's on grade 2 now. And last year he transitioned into a community school. So he left the specialized school. Now he's in a regular classroom, but I brought that information that he needs repetition to understand what he's actually reading. Or if somebody tells him a story, he needs time to process and understand what he said. And I think that is a key piece as an early intervention, to understand what it is and deal with that at the time that we are detecting. Yeah, maybe they will catch up on their own, maybe, but there is a lot of things that we don't know. So why not be proactive? And in every province, there's different resources that the families can actually ask the schools for extra resources, or their neonatal follow-up clinics for extra resources.
Yeah, and you can even, like, I've brought particularly speech language reports in my school board in Ontario. There are speech and language pathologists who work for the school board. They're more like in an advisory capacity. They don't always provide therapy, but you drop off that speech report at my school, it would go to the special ed department, and then the speech therapist would give it a read over and be speaking with the teacher about it, right? And following up in that way. So you're making those connections so your child is identified and followed along the way. Versus like if you kept that information to yourself, right? Your teacher might say, oh, wow, there's maybe something going on with speech. I don't know what it is. And then they'd kind of talk about it and maybe then say, oh, ask the speech pathologist to come in and have a look at your child. And right? When all this time you had this information that they could have had, right? To help them inform and maybe more quickly have gotten a better picture of your child.
Absolutely.
Right?
So we already talked about early intervention. So how important do you think it is, early intervention, for our children, especially transitioning to either a daycare or to the school system?
Yeah, I think it's really, really key. And I went back to that piece. I can remember how tired I was. And when it was like the 4th or 5th appointment of the week. And I can remember physio calling and saying, I went at 3 months to physio, then they called at 6. And I was like, she can sit on her own. I'm sure it's fine. I don't need to, you kind of have these thoughts, like, can I do one more appointment, right? But then I'd make myself go as hard as it was sometimes, to be totally honest, when you're seeing so many different professionals. But what that did was allowed me to have confidence that she was either developing appropriately in this way or what I needed to intervene in. And it also allowed, as the children age, new things will pop up. And so if they're being followed, you're going to catch them right away, right? My daughter ended up not needing physio, but because I attended all my appointments, had she at some point needed physio, she would have received what she needed right away versus going back on maybe a wait list, right? Because you weren't part of the system. So both in the education and the healthcare system, it's really important to sort of like maintain your spot in the system, right? As soon as you become removed or kind of come out of it, then you're kind of re-entering again. You can go back onto wait lists. And you really want to avoid that situation. And something else I kind of touched on before just was in Ontario, there are wait lists, and I'm sure in other places in Canada for many of the allied health professions like speech and language pathology, physio, occupational therapy, often wait lists. And so I do encourage everyone who's listening today, if you have a preemie and you haven't, and you are employed and have private health insurance, to go find out what you have privately available to you. So that if you hear in case of my daughter, there was an 8-month to a year wait list for her to get some of the speech therapy she needed. So we were able to access our private benefits to start that therapy earlier, and then she transitioned back into the public system. So if you have that available to you, it's kind of similar in the school system too. There's often wait lists for services. It's just an unfortunate part of the system. And if you have other resources available to you, right, that you can access, that's really important too. And often people have benefits that go unused. They didn't know they had,
right,
psychology benefits or other benefits they can access to help, because that early intervention piece is so much. And with my daughter's speech, if we had waited for her to access in the public system, it wouldn't have been corrected for JK, and they would have had a lot more trouble understanding her. But because we were able to start earlier, she entered JK in a more able to be understood way, right?
right.
And that's
Absolutely
really important too, to just maximize the skills your child has when they're entering school, because it is a whole new world. And in Ontario, they're big classes, there's a lot of kids, and the more skills they can have, the better they'll transition and navigate into that new environment.
Absolutely. Now, as a teacher, on your teacher's hat,
Yes.
what do you recommend other parents to do as their kids enter the school system?
Just remember that the teachers mean well, and that you are the expert on your child, and that you may be the first parent they're coming across who's being open about prematurity. You may be, the second child coming into their school that has that diagnosis, right? And you as the parent, I find you're such an expert, and you've maybe joined the Canadian Premature Babies, and you have all this information, but the teacher just kind of has a general overview of general and regular child development typically, right? So just remembering to, that don't assume that they know, right? And make sure that you are providing as much information as you can. I found and I was saying earlier, even in my experience as a teacher, I found the system hard to navigate, right? I went in, I'm trying to talk about my daughter's issues with her hearing, and I feel like, well, they should understand about that. And often they didn't. I was having to explain things and suggest, I knew we have hearing itinerant specialist teachers in our board. Maybe you should be speaking to one of them, right? And just that advocacy piece, because you're the expert on your child, and that teacher does not have the background you have in your child, right? So give them grace, because in my experience, all the teachers my child have met really, really well, and really want to do the best by your child. And you need to do your part by giving them the information and be forthcoming with the information they need to be successful. I know a lot of parents are very scared of their child being labeled. That comes up. I don't want my child to have a label. But it's an unfortunate reality of the educational system that if they have more information about your child, they can draw on services to support them. And if you withhold information or aren't reminding them, the squeaky wheel sort of situation, then your child may miss out on things that they need.
Absolutely. And we were talking this afternoon when you mentioned that you can have the audio system in the class to amplify the teachers. And I think this is something so very important right now, that the teachers are going to be wearing masks, and we can talk about that a little bit later. But before we go into that, I want you to touch a little bit on kids who are in the older grades, for instance, kids who actually need IPs and school accommodations, and what can parents do? Because when I left the specialized school into the system, now my son is in this regular classroom with 20 other kids, and he can get easily distracted. He has an EA just for him, because I really advocate for that, because he has quadriplegia cerebral palsy. He cannot do anything by himself. So I came with all that information plus the IP from the other school, and I still had to advocate for him to have everything in place that he needs for the school to start. So in your experience, now parents are going to older grades and needs change. So what can they do?
Yeah, so your first line of defense is, as things are changing and evolving in your child's education, is typically, again, speaking from an Ontario perspective, your classroom teacher is the first person you're engaging with. But in Ontario, there are, and throughout Canada too, there will be special education services and teachers supporting the classroom teacher who have expertise in different areas, right? So sometimes you have to move the conversation beyond, oh, that's what you're doing in class. okay, what does the special education teacher at your school, have they been in to observe my child? Or have you spoken to them about it as a next step? And they have different names at every single school. Even if I go down, not every school boards, even if I like go to Guelph, I live in Cambridge and I just drive 15 minutes to Guelph, they call the position something else. But in the end, it's the special education teacher, whatever title or acronym they give it, that will be able to support that classroom teacher with more specialized information and knowledge, right? And in our school board goes even further. There's the school one, but my daughter has hearing needs, so she also has a hearing itinerant teacher that follows up with her needs as well. I don't know if your son has an orthopedic specialist teacher that maybe follows up. The orthopedic students that come to my class, I'm also, as a teacher, liaising with the orthopedic itinerant teacher to support that student's needs as well, right? So this teacher, although you only see the teacher, there's a team behind them somehow, however it's organized where they are. It's a little different everywhere. There is a team and there are resources available. And so sometimes it's helpful too to sort of remind like the educational staff, if they seem overwhelmed or they don't seem to understand or they're questioning things, that they as the educator have these other things available to them, right? Because that's kind of where then that team approach comes into place and you're getting other people's expertise, right? And other people chosen to specialize in those things. So if they aren't already involved, get those other teachers involved to support the classroom teacher, right? Because that classroom teacher does have 20 kids in front of them. They're trying to teach to everybody in the class, and they've got a student with differing needs, and it can be hard for them to just all on their own magically meet that every single student's needs, right? And that's what the special ed team at the school is for, is to support that and help move that through. And if you have concerns, like, go right away. Don't wait, like, call the teacher, it's digital age, email the teacher and ask for a meeting and say, what have been your observations? This is what I'm seeing at home, or this is what I'm kind of hearing about their experience at school. And then don't be afraid to involve those other people in the school experience, because, like, as I say, Rome wasn't built in the day and it takes a team. And traditionally, classroom teachers are really great kind of with normal development. They have a lot of education with delivering the curriculum. But they do so often access those other specialized services. And a lot of people don't even know they exist. Absolutely. They'll just say, I talked to my classroom teacher. They don't seem to know what's going on. Like, I'm frustrated, whatever, I don't want to go. But they do have a team behind them, right? So to make sure that or ask about that to the classroom teacher. Have you talked to the special ed department? Have you spoken to other colleagues around to help? Right?
Absolutely. And I think it's also important for parents to ask the questions and have the right expectations. Because when I heard, okay, when he goes to school, he's going to have OT, PT, speech. But what I didn't know is that when he transitioned to the school system, those therapists are not there to do physical therapy on your child. At least not in our board. We are in the Catholic board in Toronto, and in our board, they go there as a consultant to see equipment, to see if he needs an adjustment to his sitting, or if he can apply for another sitting, or for a commode, or for equipment and the environment of the classroom, rather than actually work on your child on gaining motor skills. And I think that's important for parents to ask those questions, because we might come with some expectations and then, but that's not my expectation. Yeah. But it's really, we don't understand the system. And so I think questioning is always important.
Yeah, there's a thing in elementary education. What does it look like, sound like, and feel like that you do with the kids, right? When they're learning, you almost need to have that discussion. So you're saying there are physiotherapy services. What does that look like, feel like, and sound like for my child? What is actually going to occur? And then you get the answer, it's going to look like someone checking in a couple times a year. It's going to sound like them making recommendations around seating from the OT. And it's going to feel like a consultant role with a little bit of information. And then you're going to kind of clue into yourself, oh, well, that's not what I was expecting. And it's the exact same thing in our board. If you want physio services, you have to go to your local children's treatment center. Where I live, it's called Kids Ability, and get on a wait list there for physiotherapy services, like actual exercising part of physiotherapy, or the stretching and the balance and those pieces. The actual therapy part is given through that, right? It's not given in the school. Yeah, so really important. I always, in my mind, even if I don't put it in the look like, sounds like, and feel like way, in my mind, that's what the description I want. So you're telling me they're going to get this, but what is it actually going to look like? And what's it actually going to sound like? And what's it actually going to feel like? Right? Like what's actually going to occur, so that you're on the same page. And then you'll really end up in less sort of confrontational positions with the school, because they may feel like, well, but we told you this was going to happen. And you're thinking to yourself, well, I thought this was going to happen. And then you end up kind of maybe butting heads unnecessarily because the expectations weren't realistic to the situation.
Absolutely. Oh, this is so great. So we should have that little nugget. What does it look like? Right. It's so perfect for all of us parents to really keep that in mind. So now let's talk about what is really in parents' mind at this moment. Going back to school in the middle of the pandemic, whatever that is going to look like. Some people you choose to send the kids to school. Other people keep the kids at home and do online, as we've been doing for the last few months. Other people are going to are creating these pods with their little bubbles.
They're quite the
so whatever it is for the family, it's perfect for that family. And families should absolutely not feel judged, because whatever they choose is right for them. So, but as a special needs teacher, how do you see that transitioning happening right now? Because parents, I follow so many parents groups, and as a special parent myself, and having a child with a compromised immune system, I don't really want to think about that much, but the time is coming and we have to make that decision. So how do you see that today? Because everything can change tomorrow.
Yeah. First of all, everybody is overwhelmed. As a teacher is overwhelmed. As a parent, I'm overwhelmed. I mentioned my daughter's hearing issue. We've seen her try to speak to people who have masks on. She reads lips. She reads the closed captioning on the TV. She doesn't just rely on her hearing to understand language. And she's in French immersion. Half her day is in French. Oh, I'm not anticipating French class. For French, half of the day will be fantastic when she's not able to read lips any longer, right? So I think one important thing to know is whether or not your child is maybe doing an online program or coming back to school, there are going to be unanticipated things that may challenge your child in new ways, right? There may be some great things about it for some kids. I can already think a couple of kids in my class who are going to love the structure of the COVID classroom. They're going to feel relaxed and great, know exactly what I sit here and I do this, and they're going to really thrive in that, right? Whereas I could see my daughter is maybe going to struggle more than she ever has before with her hearing, right? So the school experience is going to, again, look like, sound like, and feel different than it did before, which means your child may respond differently, and you may have to change course or adjust what their needs, right? The IEP we talked about before, which is the plan to help students who have the individual education plan. It's the plan on paper that kind of is going to guide how to best support the students that need one. And that plan may need to be adjusted in the age of COVID because school is so different. And I would say to sort of anticipate that a little bit. And again, what the IEP or what accommodations your child had in a classroom setting may look very different if you choose to go to a digital platform. And if you're in a digital platform, you are still entitled to special education services, but it's going to look completely different in the digital world than it did in a classroom, right? And so just sort of anticipate that and not be surprised if that would happen, right?
because it is going to be so different. And we've never done this before. So I'm sort of thinking of my students, right? I said, oh, I know that one might really like the structure, and that one it'll be like the worst thing ever for them. They just want to get up and be active, and unfortunately have to sit in one place or whatnot, right? And so trying to find success for your child within the limitations of COVID too, right? And being flexible as a parent, because often the school isn't going to be having necessarily the final say. It might be public health that is mandating some of this. So as a school and as a parent, some of your flexibility in terms of accommodating your child to some degree might be limited or changed as well. And often it may not even be the school or the teacher that wants to do that. It may be driven by public health too. So it's kind of a very complex situation they're returning to, and just be ready to kind of pivot and respond to their different school experience, and that your child may need different things this year than they needed other years to be successful because of the change in the environment, right?
Absolutely. I think you have to learn how to manage our own expectations as parents, and because this is a world issue, it's not one little city issue that only a few people are facing. This is the entire world facing at the same time.
And our school board has said to us as teachers too, so in this day and age, everything's about data, right? Like standardized testing and making sure you're delivering the curriculum, and that drive kind of in the background from society, keeping education accountable, and all these things you hear, right? Especially during political times, you hear them more. And I know what our board has said to us, that the child's well-being is what is most important right now, that we are in a pandemic. These are not regular times. And what, as teachers, we need to pivot our thinking a little bit to maybe being less about, am I delivering the curriculum, and really take on that social emotional piece more, right? You know, how is that child doing? How are they doing socially? How are they transitioning back? How are they reacting to the new environment? And really putting our focus more there, right? Rather than on worrying as much about, did I get the exact number of minutes I needed this week for literacy, right? Because recognizing children are under stress, children often don't learn as well if they're under stress, that they're learning in a new environment. COVID has been extremely stressful for parents, and so you don't know kind of what home environment or how COVID has affected them at home when they're coming to you, right?
Absolutely, but the children also bring their own anxiety of going back if they've been in lockdown for so long. I know my son, he's being very isolated and he's looking forward to going to school. And for me, it's like, it's no option, not send him at least for the first week because he wants to see his friends. And I worry about obviously his well-being, his mental health and his social skills. So for me, okay, let's go back, check it out the first week, see how you feel. And also some kids are anxious about going back. My older son does not want to go back in person to school because he's like, I'm not sure about that. Yeah. So I think we have to also acknowledge the children's feelings because they feed off our feelings, right? If we're anxious, they're anxious. And then how they're going to manage those every day at school with the teacher wearing a mask and everything looks very different.
Yeah, and they also, I think it's important, like I've been very blunt with my children. Like I've been point blank, school is not going to be the same. What did you really love about school? My one daughter said, I love choir and gym class. Well, yeah, no more choir, not allowed to sing, can't be sending those droplets out into the air. And gym class is going to be outside, and we have a wonderful phys ed program with like so much equipment and all. And I was like, and the equipment room's probably going to be locked up most of the time, right? And also, I think it's important to, even at a young age, my younger daughter's 7, but I'm still having those conversations about how it's going to look different, because you've used the term expectations a few times in this conversation, Fabiana, and that's true for children. And as much as possible, letting them know, it might make them a little more anxious to go back, but they won't be as surprised when they get there, right? And so to let them know, you know, if they ask, there might not be choir this year, that everyone's wearing masks, that, you know, if your friend isn't in your class this year, you might not be able to play with them at recess, right? these are things that kids don't think. I'm going to see all my friends. And my daughters go to a large school with 750 kids. There's multiple classes in each grade. They're not going to see all their friends when they go to school. And I prepared them for that. I said, your best friend might be in a different class than you. And so you might not see them. And then it like pinged in their mind, oh, I didn't think of that, right? Yeah. And again, that's where advocacy can come in. If you have a very socially anxious, your child is very socially anxious, maybe they only had one friend, you let in the bubble over the break. I also think, and I've been having conversations with my colleagues, it's okay to make those requests of the school a little bit too in COVID. If you're at a large school like ours and making that call saying, my son is nervous, scared, my daughter is feeling this way, can you make these two students be together potentially, right? Because they were part of our bubble and it was the only other child face they saw for 5 months, let's say, for example, right? And that in the past, that might have, my friends and I were discussing in the past, like teachers would kind of be like, oh, we just want to make the classes work. Why do the parents like have opinions about friends? Because you could say they'll still play with their friends at recess, they'll still be in choir with their best friend, and they can sign up to the same intramural activity at lunch, right? And then none of that's available. And so it's okay then to like speak to the school and ask some of those questions too if you think your child needs to be paired, you know, with a friend, for example, right? And you have to think about some other things you might not have considered before.
Absolutely.
And two children can be very different, right? You're talking about your two sons. I have a friend, she has two daughters. One kind of isn't concerned about COVID at all. The other one has started compulsively washing her hands. You know, my friend said to me, you know, I'm concerned about her. She is hand sanitizing like 550 times a day. She doesn't want to touch anything. She's like, right? And so to recognize what your one child needs might not be what your other child needs based on personality or whatever it is, right?
Absolutely. Yeah. So Shanon, let's finish here today. I think we could talk much longer because there's so much to say at this time, especially in this transition from end of summer into school. One positive message for parents out there who might be first transitioning to either daycare or the school system, because it is a challenging times. We know it. So we protect our baby from the NICU and we carry that baby. We are the mama bears and the papa bears, and now it's time to let it go. One message for those parents.
I think I would say it's a pandemic, and whatever choice you need for your family to be healthy and well, as it can be during a pandemic, is the choice you need to make for your family. And you don't have to know everything. And one day, hopefully, there's been other pandemics in the past, they do end. Whatever decision or choice you made today is not your child's entire future. And if you choose to go digital halfway through the year, decide to go back in person, you go in the other direction, the decision you make today, although it seems like everything right now, your child is going to have a lifetime. School will become more normal again, and they will be okay. And there are a lot of research from these sorts of things, like academically I'm talking about. Don't worry, like they're going to catch up again. They'll gain some of the skills they missed, though, right? Children are really, really resilient. And so do what you need to do for your family, right? And there's no right or wrong answer. There's no perfect answer. You might change your mind after a week, like you were saying, Fabiana. Well, there's been an outbreak in my neighborhood. We're back home again, right? And to be flexible in that, even the most knowledgeable people about COVID-19, you could turn on the TV and one's sending their kid to school and one isn't.
Right.
Right? And so there is no right or wrong or judgment. And I would say do what you need to do to kind of the best you can this time to sleep at night, right? Whatever.
Absolutely.
Your child is going to feed off of you. And if you can make a decision that you feel at least okay with, it's not going to be perfect. Their children are adaptable and resilient, and they'll feed off that. And
Absolutely.
one day they will come back to school. Hopefully, most of the children who are choosing online learning will return one day, and they will be okay too.
Absolutely. Shanon, thank you so much for your time today, for sharing your knowledge, your expertise, your experience with us. And we really appreciate it. And I think it is such an important time for parents to be kind to themselves, because
Yeah.
we've been through so much stress in the last few months, adapting to work from home, teaching kids from home, and then the whole summer without summer camps or summer camp here and there. And there is so many challenges, new challenges. And I think the most important thing is for all of us parents to take care of ourselves, so we are better able to take care of our little ones, no matter how old or how young they are.
And as a teacher, online teaching my own children from March to June was not easy, right? It was hard, and I'm a teacher. This is what I do for a living, and oh my goodness, it's extremely challenging. It isn't what school looked like, and we're not used to it, and we didn't know. So give yourself grace.
Absolutely. And I think honestly, this pandemic gave me all the reasons to be extremely grateful to all the teachers, especially my son's teacher, who really step up to the challenge to learn the technology and teach our little ones. And I'm really looking forward to the day that they can actually go back to school, learning school, because teachers are amazing. Like how much you give and put out there for our children is really, impressive. And I think a lot of parents really appreciate what teachers do all day with our kids. So Shanon, thank you so much. And I hope you well on your back to school. Thank you.
Bye.
And for all of you watching us from home or from hospital, thank you so much for being with us. We are back every Friday, 1 p.m. Eastern Time with different topics. All past sessions have been recorded and they are available on our website, and you can access them on CanadianPreemies.org. And every Wednesday, 1 p.m. Eastern Time, Kate Robson, who is a therapist and also a mom of 2 preemie girls, is hosting real-time peer support group here on Facebook. And to access her group, you can join the Canadian Preemie Parent Support Network, which is our private group for NICU parents only. There you can ask questions, you can share your experiences and your anxiety and your celebrations with parents from across Canada who actually get what we're going through at this time. So thank you so much, and I see you all next time.